Hello, thank you for coming today. For those of you that don't know me, I'm Elizabeth Thorley of Thorley Wealth Management, and my partner and financial advisor, Brooks Howard, is here as well. Please raise your hand, Brooks. We're hosting today's event, so we're very, very excited to have such a great turnout today. But I'm not surprised, because I had a feeling that healthcare would be a very popular topic this time of year. So I want to also thank the staff at Thorley Wealth Management, Eileen Byers, who you met as you came into the room today, and Denise Warner, who's back in the office. Without them, I would not be able to do these types of events. I come up with the ideas, but they put it into action. So thank you, and I really appreciate all the work that they do. I also want to thank today's sponsor and partner with this event, Nationwide Financial. Matt Rydell, next to me, is a wholesaler here in upstate New York and has coordinated the speaker, and he will be introducing it in a moment. And I have seen this presentation several times at a conference last year, educational conference, and also on a webinar presentation. And I thought it would be a great overview. It's straight to the point, and it answers a lot of questions that I think clients have. But more importantly, what I hope that this presentation does is give you some answers to questions of planning for healthcare in your retirement. One of the things I think is a major issue for planning for retirement these days, and hopefully makes you delve a little deeper into your own personal planning, and maybe set up a time for us to talk about your plans, what you've done, making sure that you're on track to enjoy retirement. So without further ado, I'm going to introduce the speaker, but I do have one other request. As you may notice, we're going to be videotaping today's presentation so that we can put it up on the web after the presentation for people that weren't able to attend, but also some of these you might want to go back and reference it. So we're going to ask that you hold your questions to the end of the presentation. We will have time for questions, and we'll make sure that they're all addressed. But for the videotape, we just ask that you hold the questions until the end. So thank you, and now Matt.
Good afternoon, everyone. We have one question already.
Tell people to turn off.
Oh, please turn off your cell phones or silence them.
Excuse me. And if you stick around after the show today, after Carlos' presentation, he has a secret code that will actually get you into the Obamacare website. So stick around for that. He tells me these things ahead of time. But thank you for your time and coming out and hearing Elizabeth today. It's my pleasure to introduce Carlo Cordasco. Carlo is really a student of the business and an industry professional. He's been in the financial services world for over 20 years, and actually almost close to 25 years. He spent a good deal of time with a little fund group called the American Funds, which some of you may own and hopefully have done well in. But Carlo has been with Nationwide now for a number of years. He is a regional vice president rather of our Retirement Institute, which is an institute that funds research like we're going to talk about today. So Carlo lives with his wife and family down in Pennsylvania. He's making the rounds, I guess, in upstate. You go from here down to New Jersey and maybe just do this all week long. So I've got a number of these events scheduled through the upstate territory, which I cover. So it's a busy week for him, and we're kicking, this is the first of many shows this week. So I think you'll get a lot out of this seminar. And again, as Elizabeth said, if we can hold off questions until the very end, he'll do his best to address them, and we're going to try to keep this thing to about an hour. So don't worry if it seems to be going long. We're well aware of the time, and we'll get you on your way just as soon as possible. So with that, I'll bring up Carlo Cordasco.
Thanks, Matt.
Thank you.
Thank you for coming out today. Two quick points I want to make, and Matt, thank you for a wonderful introduction. One is I feel really old the more he introduces me with the amount of experience I have. Because two, then you forget things. Now, I don't know what Matt's excuse is because I live in Virginia, not Pennsylvania, but most of everything else he said is true. With the exception of that code. I'm going to have to make something up between now and the end of the presentation. Well, Well, I've worked long and hard over the past 2.5 years as we've built this presentation and delivered it to remain apolitical, and Matt just threw that all away from me in one introduction. So, but no, in all seriousness, thank you for coming out today. It's a very serious presentation. It is so serious that we feed you first so you don't lose your appetite as you're going through the presentation, right? But we have worked long and hard to come up with a tool, a resource, to help advisors help individuals and couples like you. The idea up to this point is that we haven't had the focus on healthcare for very much of our financial planning with regards to retirement planning. The generations before us, and even this generation, which is now losing its healthcare benefits through their employer, through retirement, focus primarily on having a pension, focus primarily on having healthcare benefits to cover those types of things. And our parents and generations before us had pensions, had retirement income covered, had healthcare privileges covered. And they focused on their discretionary income, the stocks, the local companies they wanted to own, right? And they used those dollars for a lot of discretionary spending, for their gifting, for their planning, things like that. But early in the 1970s, Congress made some sweeping changes to retirement plans. And they took away the onus on the employer to have to mandate, so to speak, that they provide pensions. They don't have to provide pensions in the defined benefit world, if you will. They took that burden off of the employer and created a defined contribution world, which created things like the 401k. So the burden for planning for retirement was shifted from the employer to each of us in this room, which gave financial advisors an opportunity to sit down with you, find out what your needs are, find out what your income is, your goals are, and to create a plan for you. That's what's happening now here again. Fast forward to the 2000s and this decade now, the burden for providing for health care costs are now being shifted from the employer to you, the individual. For a lot of us, that'll be Medicare. At age 65, as we attain age 65, that's where we go. But for a number of us, prior to that, we may have retired with company-paid health care benefits, or at least supplemental benefits into retirement. So today, financial advisors need to gather all the information and get their hands around what it's going to take to determine your health care costs, because now that's a line item in your financial plan. If, in fact, your goal is to have a successful financial plan for the duration of your retirement, you must address health care costs. And what we've done is we have partnered with Milliman and Associates, who is the actuarial firm who drives the data behind health care costs, and we've broken it down to make it personalized and customized for you. And there are 3 particular areas where Milliman allows us to help you do that. One is your basic demographics. Where do you live? Because healthcare costs by state will have an impact on your healthcare costs. Whether I live in Pennsylvania or Virginia, I'd have different healthcare costs. I have to figure out which state makes the most sense, right? Well, that's right. Well, you know what? I'll talk about that. Maybe move someplace. I'll talk about long-term care costs as well, because even intrastate long-term care costs will vary depending on the region that you live in. So where you live, your age, your gender, when you plan on retiring, all that goes into one level of what your healthcare costs might be. The second level then is, what is your health history? Now, we don't ask for intimate details. What Milliman asks are basically 12 simple yes or no questions. Have you ever had? And if you have, how long ago? For example, did you have a cancer diagnosis? The recency of that diagnosis can have a profound impact on the future cost related to treating that. So that's all they need to know from the standpoint of yes or no questions. And then finally, and this becomes the real intimate question, how much income do you anticipate having in retirement? Now, why does Milliman, why do we, why does your advisor need to know what your income, your modified adjusted gross income may be in retirement? Those of you either on Medicare or have family members who are on Medicare, who have that amount come out of their Social Security check every month for their Part B, which we'll get into the details, which is their medical, well, that premium, as well as the premium for the Part D, are predicated upon your modified adjusted gross income. Medicare is a means-based benefit, and the more you earn in retirement, and the MAGI, your modified adjusted gross income, that bottom line of your first page of the long form, right? That is adding a lot of the tax-free stuff back that your advisor worked long and hard to help take out of your taxable income. But that gets rolled back into your basis for your Medicare premium. So based on those three things, now you know why we feed you first, right? Based on those three things, that will help determine what your projected health care costs can be going forward. So if you'll allow me to, I will move into the details here, and I'll share with you, first of all, our legal language. I want you to know that we will not talk about any products today. The team I work with, as Matt mentioned, the Nationwide Institute, the Retirement Institute, we focus on building the resources for the advisors. So once they identify what your needs are and what your goals are, then at that level will there be any conversation about investments and products. So today we're only talking about Nationwide from the standpoint of who's bringing you the resource. However, if down the road a Nationwide product is one of the solutions, then ultimately we encourage you to do your homework on Nationwide. And what you'll find is that we are a fiscally conservative organization founded by farmers in the Midwest, and we have more than 6 times on reserve our obligations to our members. So that's important for you to know. But make sure you do your homework, and our attorneys want you to know that as well. So what is my agenda for the next 40 minutes or so? And then we'll open it up to your questions. One, we'll talk about the challenges. And as you know, I'm on the road now 5 days a week talking about this 3 to 4 nights a week and every day. And I tell people I might look like I'm 53, but I'm only 40, right? Because this is how much this is keeping me busy, right? But ultimately, this is a challenge, and there's a lot of information out there, a lot of misinformation, and a lot of missing information. And my goal is to help take care of bringing those two, reconciling some of those together for you. We will talk about healthcare. I will talk about Medicare, ABCs, and so on, and help delve through that a little bit and give you a better understanding there. And then finally, the so what. What is it that you can do to start the process to help you better understand the decision? Which is why working with a good plan, with a good discipline, and more often than not, hopefully with a financial advisor, can help us avoid the mistakes we tend to make, like buying when everything is good when we should have bought when everything was bad, and selling when everything is bad when we should have sold when everything was good, right? We don't go to Sears or JCPenney or Macy's or Nordstrom on the day when everything's full price, although in some of those stores it's usually always full price, right? We go when they have the good sales. And the same thing with investing. So what I want you to understand that for each of you in this room, you all have your optimal mix of how much growth you're going to need, how much protection of your assets you're going to need to drive the income you're going to need and when you need it. And why do I bring that up? Well, because there's a word up there that a lot of people don't necessarily like to hear when it comes to their retirement, because that means being invested in the market. Here I am, I've worked long and hard, I've saved all these dollars, the market's gone up, the market's gone down, I've been whipsawed, I'm emotionally frazzled with all this, please don't lose this, get me through retirement, right? What are we worried about? We're worried about the market, right? But they can only fool us so long with a can of tuna fish that I remember being almost 7 ounces. Now it's like, what, 5 3/8? But it's still only $1.49, right? What's that called? Inflation, right? We need growth of income in retirement. Healthcare costs aren't going to be less expensive in the future. So if we get too conservative in retirement and we're worried about the market, we will lose pace with the marketplace. And so a good advisor will make sure that you have the right blend of investments to give you the growth you need for growth of income, but also to give you a portion of your portfolio with some protection to protect the assets, to give you the income you need. And the other takeaway from this is, remember this, we do not retire on our assets. We've worked long and hard, please don't lose these, right? But we retire on the income those assets can generate. And two very different investment strategies can generate very different income from the same assets. You have retiree A, retired with $500,000 in investable assets. Retiree B, retired with $500,000 in investable assets. One became ultra conservative, and one had a nice blend of stocks, bonds, cash, and so on and so on. One dealt with the ups and downs of the markets, but their advisor provided them with some protection along the way. And one lost pace of inflation, right? Is either one right or wrong? Maybe, but both are probably right as well, because you should have some safe money in retirement. You should have some money invested in the market, and a good advisor will find which blend makes the most sense for you. So that's important to know as you think about planning for healthcare, and that's about as deep into any product conceptually I will go into for this presentation. So now let's talk about our attitudes and the emotions, and why the emotions. Well, before we retire, when it comes to things like market loss and inflation, right? I already talked about the tuna fish, right? Maybe we're buying 2 cans now because we can, because we still have income. to be able to do that, and maybe we're still getting raises along the way, right? And when the market's down and you get that 401k statement and you're not spending those dollars, the market might be down, but you noticed, hey, you know what? That $50, $100, $250 that went in the last pay, that bought more shares this month than it did last month. That's not a bad thing. Hopefully when the market's back, my more shares will be worth more money, right? So we can tolerate it as long as we're still working. It's aggravating. Nobody likes a quarterly statement that shows their retirement dollars down this quarter from last. But a lot of times, perspective is important, because if you look at the last 10 quarters, last 40 quarters, pretty good chance even today's lows are higher than yesterday's highs, right? Because we've moved along on that up and down yo-yo on the escalator, if you will, right? On an up escalator. So, but what can be aggravating in accumulation can easily become devastating in distribution, because now if we're taking money out, now the market's down, we're taking money out, and the market's down, prices are up, and money's coming out. Now all of a sudden, we're thinking, how long is this money going to last, right? So a good financial advisor will make sure your plan has a way to accommodate inflation by offering you some gain in income. Also has some protection against market loss to protect your assets, to generate the income, so that more importantly, you don't outlive your assets, you provide for a surviving spouse, and for the benefits of this conversation today, and the balance of it, for health care along the way, right? So, all that being said, this sets the stage for talking about health care. It's expensive, it's complex, and it's probably one of your top concerns, if not your top concern, especially today with the immediacy of everything in the news. One of the things that people are concerned about running out of money because of are health care costs, right? So we address it by helping giving you some perspective. One, looking back at the last 10 years, health care inflation ran much higher than regular inflation. So put it into terms of cans of tuna fish, it's probably a 1 ounce can now, right, for $1.49, right? So we have to make sure we're able to have the income we need from the growth in our portfolio to provide us the growth of income we need for the increasing health care costs. Number two, if we don't get that right, we may not go broke. It may not break our retirement, but it might break our plan. For example, if we take a look at some of the struggles that people will face if they don't put enough aside for their health care, the way I pretty much like to summarize it is, what are some of the things you would like to do in retirement? Do you like to travel? Do you want to take a cruise overseas? Do you want to put grandkids through college, or is there a certain motorcycle brand you want to go out and buy and ride east to west and west to east and so on, right? In retirement, what is it? Because what will happen is those are the things that will have to go first to pay for your health care costs. So it may not break your health care, it may not break your retirement plan, but it might break your plan to have fun in retirement. So our goal is to help you do as much as you can to make sure the things you'd like to do in retirement are protected along the way as well. And then I talked about this a little bit earlier in one way, when I talked about how the burden for planning for retirement has been shifted from the employer onto us. Well, this is the proof in the pudding here, as some of you have also experienced firsthand, that fewer and fewer of us will retire with health care benefits. From 93 to 2011, and the trend continues downward and to the right. As you can see here, fewer retirees taking early buyouts are going to retire with a health care benefit package, less than 1 in 4. Those of us attaining age 65 who have been gainfully employed for a number of years, who might otherwise have retired with health care benefits, now have less than a 1 in 6 chance of retiring with those benefits. So the majority of those costs for health care are now being shifted from the employer to us in the form of Medicare. The problem with that is that most people don't understand what Medicare is going to cost them and how much they're going to have to contribute towards those health care costs. So, Nationwide did a survey back in January of 2012, and we have the top 6 answers on the board. But when we initially gave the survey, we asked the newly retired individuals, what do you anticipate your health care costs being this year, in 2012, meaning last year? They added the 6th one on there. We gave them the top 5, and they added the 6th one. There were a number of people who said, you know what, I have no idea, it's not even worth guessing, I know I'm going to be wrong. Well, take a look at how the numbers came in when we asked them to pick what they thought their health care cost would be all in 2012. And as you can see here, the largest response came from those who didn't know. And for perspective, 4 out of 5 either didn't know or underestimated what those costs were going to be. And I would guess the 1 out of 5 who got it right, probably some of those folks guessed correctly as well, right? Because if you consider Medicare premiums, if you consider what Medicare doesn't cover, if you consider over-the-counter, if you consider things of that nature where you'll have both premiums and out-of-pocket costs you should have expected in 2012 as an individual for your total health care costs, even with Medicare, to cost you somewhere north of $6,000. Do the math, right? And you've now got about $500 a month on average. Now, you may say, yeah, but my premium for Part B was coming out of my Social Security. Well, isn't that really still costing you what you could have spent out of your Social Security? So, but I also, in full disclosure, want to acknowledge that maybe all of it wasn't coming out of pocket directly, okay? So, that's an issue. That's why the resource, the tools like this. How about Medicare? They say if you want to teach, the best way to learn something is to have to teach it. So I learned from my mom 6 years ago when she needed help with her Medicare, when she and I both thought Medicare covered just about everything. And what did we find out? You pay your premiums. And by the way, this thing called the donut hole in prescription, which I'll get to, that's pretty hefty out of pocket as well, especially if you're taking a handful or more of medications on a regular basis. So we'll talk about that. Also, I mentioned this earlier, and the scope of today's presentation does not include long-term care per se, but we do have the resources to help you determine those costs, and it's something we can do again down the road. If you do clap afterwards, because it was worthy of clapping afterwards, if this was a good presentation for all of you, maybe we can do long-term care down the road. But Medicare does not cover long-term care. I'll address why more people than not think it does. And I'll show you how you can walk away differentiating where it does and where it doesn't, and make sure you tell your friends and relatives what you learned today so they know as well not to wait till they need it, because when it comes to long-term care, most people want it when they need it, and when you need it, you can't get it. You need it before you need it, right? You need to buy it before you need it. So we'll talk about that. Okay. Fidelity Investments did a survey, a study on healthcare costs, and these numbers are very mind-boggling if you look at them in their entirety. But I'll ask you, if you ever bought a house for $200,000, $400,000, $500,000, $800,000, $1 million, and you bought it over a normalized interest rate environment, and you paid for that house over 30 years, you paid about 3 times the selling price for that house. My parents bought a house where I grew up in Newark, New Jersey, which is why you don't hear any y'all in me from Virginia, right, Matt? That's why I confused Matt, right? Anyway, they bought a house for $100,000, which over 30 years, they spent $300,000 to buy. If the mortgage broker told my mom at the close, or when they made the offer, by the way, Mrs. Cordasco, this house is going to cost you $300,000, she'd have said, no way, we're going to be renters for life. But the house cost $100,000, but she didn't need, and my dad didn't need $100,000 to buy the house. How'd they buy it? They bought it monthly. They paid their mortgage. Well, this is the cost of buying your health care over the course of your retirement. You don't need $250,000. You don't need $430,000. By the way, this is a 65-year-old couple today with normal life expectancy, 82 and 85. Ladies live longer because they're sweeter, right? Gentlemen, we withhold too much, I think, is what they tell us, right? But who's telling? Who's talking, right? If you have longer than average life expectancy, 92 and 94 respectively, the longer you live, and this is counterintuitive, people think, I'm not healthy, my health care costs are going to be very expensive in retirement, and what they don't realize is they're right, but they're not completely right, because the less healthy you are, typically the less longer you live. The longer you live, the more compounding of health care costs you have going up, the more expensive health care becomes. So, in fact, the last 4 to 5 years in retirement are generally the most expensive years for health care when it comes to the expenses you're going from that person behind you, in front of you, to your left and to your right. And so averages were good for planning when that's all we had, but now we can drill down to your specific numbers. All that being said, Matt, if you wouldn't mind, if we get the kits out and we just need one per household, that'd be great. I know we have some, they're ready to run with the kits in the back. Sorry to give you a big enough heads up back there, but I realized I didn't address the pie chart here, so let me do that real quick for you. The pie chart is indicative of where you're spending your dollars when you're spending your Medicare. So unfortunately, this does not include a supplemental plan. Otherwise, the premiums would be higher and the out-of-pocket costs would be lower, but that's just the way Fidelity did their study. But we'll address that as we go forward. So as we're passing out the kits, before you get to the kit, let me show you what we talk about when it comes to Medicare. For those of you who might be retired, career military, we say thank you very much for and appreciate your service to the country. If you've retired with TRICARE, this is a different conversation then. Today, for those of you who don't have TRICARE, you have the choice of two basic Medicare options. You have Advantage plans and you have Original Medicare. The Advantage plan basically will allow you to enroll in Part A and Part B, which will then allow you then to have a prescription plan that comes along with the Advantage plan. The Advantage plan is nice because it has lower cost up front, lower cost to operate and own, and if you stay within the network, you're able to need less paperwork, less reporting, and so on. By buying into an Advantage plan, which is similar to an HMO or a PPO, what you've done is you've said, I will work within this system to see these physicians, these specialists, use these facilities for my health care, which keeps those costs down. The other nice thing about Advantage plans is that they come with what someone in a seminar called dental, vision, and hearing light, meaning you get your annual checkups, but I'm thinking about my in-laws who are 76. I think they go to the eye doctor, they go to the dentist, and they go to the ear doctor more than they go to any doctor, and that's the least coverage they get from their Medicare, right? So it's kind of counterintuitive, but at least with an Advantage plan, you get the annual checkups. What's the downside to an Advantage plan? If you travel. Do you have family out of state? Do you go overseas on vacation? If you take this with you, it may cover some of the cost up to what it might have provided for in network, but beyond that, you're responsible for those costs. So while it might be less expensive and comprehensive and convenient to own, it may be something you want to own later in retirement when you're not as mobile, if you will, and you can work within that actual network. So it may make sense for some of you today, it may make sense for some of you in the future, it may be what you want to own, and that's okay. For those who like more control, who like to have more control over who they see, where they go to see them, because you're traveling, because you like to pick specific prescription plans, pick specific supplemental plans, you have Medicare Part A, and that's you have Medicare Option 1, which I'll talk about now. And in the kit, if you open up on the left-hand side, there's a piece with a stethoscope on the cover. And if you turn in that piece, it's the second piece in the left-hand side, to page 9, you will see the breakdown of Medicare Parts A, B, D, and so on. So if you'd like to take some notes and follow along here, please feel free to do so. But I talked about Medicare and long-term care, and why do people confuse it with long-term care? Take a look at the second and third bullet points. People see someone go into the hospital, come out, go into a care facility, come home, have someone come into their home, provide care for them. They confuse what that care is being delivered for with where it's being delivered. And here's what we have to remember. Medicare will pay for up to 100 days of follow-up coverage after a 3-day or longer hospitalization of where and when you've been admitted. If you've just been observed, they don't cover the follow-up. So make sure if you or a family member or loved one is going to the hospital, if they're staying overnight, when you talk to the patient advocate, ask, are they being admitted or observed? And they'll know why you're asking, because you know if there's any chance of follow-up care needed and Medicare is their coverage, you want them admitted for those 3 days or longer, so Medicare will kick in. So what does Medicare pay for? Up to 100 days, short-term or acute, where you're making progress. What Medicare won't pay for is long-term or chronic, where you're not making progress. Example, stroke. Someone's hospitalized for a stroke. Maybe they've lost the use of a limb. Maybe they've lost vision. Maybe there's another debilitation. The point is, you can have two people hospitalized in the same hospital, in the same room, sharing a room side by side in beds, one where Medicare is going to pay for the follow-up and one where it's not. Why? Not where they're going to go, but why they're going there. If, in fact, you have a stroke and your diagnosis is you will not make any progress or recover, that's a long-term care issue. If you have a stroke and your diagnosis or prognosis is you should recover and you're receiving treatment and you plateau, no longer making progress, Medicare stops paying. If you have a stroke, and it could be any ailment, right? I'm using stroke as an example. You have a stroke, doctor says you should get better, let's get you into physical therapy, you're making progress, Medicare will pay up to 100 days of that care following up. So short-term, long-term, acute, chronic, making progress, not making progress. That's the big difference. That make sense? Okay. So all that being said, what does Part A cost? Well, if you work 10 years or 40 quarters, or you're married to someone who has, once you turn age 65, you don't have a premium for Part A. But you will have a deductible should you be hospitalized, and that deductible is good for the first 60 days. And then beyond that, if you're hospitalized for an extended stay, the premiums go up pretty extensively over time. That's the bad news. The good news is you can buy a supplemental plan that covers deductibles and copays. And we'll talk about that in a moment. Where does our tool begin to drill down to help you better understand your costs for Part B, which is medical, so going to the doctor, preventative benefits, and so on? You can see here, I mentioned it earlier, that there should be an M in there, should be modified adjusted gross income, smaller deductible with a 20% copay once you meet our deductible. But what does it cost you based on what your income is along the way, and how different can that cost be, and why does a financial advisor want you to have this conversation with them sooner than later? Well, if you're single or if you're married filing individually, these are the brackets and the ranges of your modified adjusted gross income each year. If you're married and filing jointly, there are your ranges and brackets, and this is your premium per month per person. So look at the 104.90 versus the 209 versus the 335. Times 2 people times 12 months times 20, 25 years in retirement, very different dollar amounts need to be set aside to generate the income for your healthcare costs. So think about where you might fall in the modified adjusted gross income and how important it is based on where you live, based on your health history, and on what you earn, and how we can help you get this right. It's a tool that is going to be helpful and beneficial to your overall retirement plan. Part D is prescription. So we have A, we have B, hospital, medical, now we have prescription. Prescription comes in 2 ways. One is through the Advantage plan, or the other way is through traditional Medicare. And that's where you will identify the prescriptions you're taking and measure it up against the plans available to see which ones cover the meds you're taking to give you the best coverage along the way. Once you find those plans, you shop them for the best price. So when can you enroll in prescription? Once you've purchased your A and your B, you can buy your prescription plan. If you want to make changes, it starts very soon. If a drug is no longer covered, or if you're taking a new drug that wasn't covered, and you want to make a plan change, come October 15th through December 7th, you can update your prescription plan, which will kick in January 1 of the following year. So you have A, hospital, B, doctor. Now you know how to get your drugs paid for, but the drugs won't be paid for in their entirety, right? And this is the dreaded donut hole. How does it work? Well, it starts with a small deductible. We buy our Medicare, we buy our prescription, and we meet our deductible of $325. That won't break our plan, potentially, right? For those of us in the room working with a financial advisor, we should be able to meet that, right? Ultimately now, once we've met that, the plan picks up 75%, we're responsible for 25%. That sounds good, it's the way it should be. But then we hit the donut hole, and the donut hole is a big fat zero, meaning you're responsible for 100%, there's no coverage. And the donut hole says, once you've reached about $2,970 in drug costs, or about $661 out of pocket, you're now responsible for 100% of your drug costs, up to a total drug cost of just over $6,700, where you're responsible for $4,700. Now go back to my slide originally where I said most people underestimate what their healthcare costs can be, and how many, 79% said less than $6,000. If you are taking multiple prescription drugs over the course of the year, that alone can cost you almost $5,000 out of pocket. So that can be pretty expensive, right? So that's why it's important to have a good understanding of what your healthcare costs are going to be. Now, the good news to the bad news here, the silver lining, is that should you get through the donut hole, there is what is called catastrophic coverage. And for the balance of that year, your Medicare coverage will pick up 95% of the drug costs. You'll pick up 5% along the way. But that does reset every year. Okay, does that make sense? One thing to know, the Affordable Care Act will phase the donut hole out by 2020. So we will get into a copay environment by 2020. Those who make more, though, will pay more for their prescription up front, and that's one of the ways to offset the phase out of the donut hole. All right. The last thing is on Medicare will be supplemental plans, and this is where you can buy coverage to provide coverage for the coverage you bought and where it doesn't provide coverage. And that's what you have to repeat after me 5 times. It's coverage you buy to provide coverage, right? To provide coverage where the coverage you bought doesn't provide coverage. So basically, it's the part. You're not going to try it? Okay. No, you're probably shy because we're recording. I'm sorry. Anyway, we have Part A with a deductible and copay. We have Part B with a deductible and copay. This picks up those deductibles and copays. So it's being pound-wise, if you will, to spend the pennies to buy the extra coverage. If you don't buy this when you're first eligible, so you roll in A and B, now you have 6 months to buy this, your insurability is protected and there are no pre-existing conditions that you can be penalized for. But if you wait because you're healthy and think, I don't want it now, I'm not going to use my A or my B, I exercise, I eat right, I floss, I look both ways when I cross the street, nothing's going to take me down, right? I'll wait till I'm 75 years old, I'm in good shape. Guess what? The government says if you wait, you will have higher premiums for your B and for your D that will stay with you for retirement, and you will have to answer questions to make sure you're still insurable or that you don't have anything that they can't charge you more for. They want you in the pool with everybody else because someday you will be the person who needs the coverage. But right now you may be the person paying in so other people can use it. Our day will come, and the law of big numbers and pooling risk, the government says, once you're eligible to enroll, we want you to enroll. I'll address that enrolling in just a moment. $1 per person, about $600 per couple, just on a monthly basis, right? Just to have your Medicare card in your wallet. But the real question then is, and where we can help you is, what will it cost when I need it along the way? And that's what our assessment can do for you. So I'm going to skip past this slide because I already addressed Advantage plans, if you will. And so what we'll do here is we'll talk about enrolling, and then we'll open it up to your questions after I show you one more thing in the kit. So when can you enroll in Medicare? Well, you can enroll in Medicare at age 65. When can you apply? You can apply as early as 3 months prior to turning 65. And if you do, your Medicare coverage kicks in day 1 of your birth month. What if you're still working? Or what if you're covered by a spouse who's still working and you're covered by that plan? Well, either way, odds are if you turn age 65, you'll still need to enroll in Part A, which is your hospitalization, which would typically come with no premium if someone was working and paying into it, right? Why? Because Medicare says, we want you enrolled, we want you on the books, but if you have a company plan, a creditable plan, and that plan covers you if you go to the hospital, but comes with copays and deductibles, the Medicare Part A will help offset your copays and deductibles. So Medicare is saying, we don't want those costs to be a burden on you, we'll pick up some of those costs. So you probably, in all likelihood, unless you work for an employer of 20 or fewer, or got a deal from the federal government with a company that did, you'll probably not have to enroll in B, D, or supplemental, as long as you or a spouse are still part of a creditable plan and you're covered by that plan. But here are three numbers to remember. There's 7, 8, and 6. 7 is those 7 months when you can apply for Medicare, right? So 3 months prior to your birth month, the birth month, and 3 months after, okay? Let's say you're just enrolled in A because you're covered by a plan. Down the road, call it age 66, 67, 70. You're no longer part of the plan. You now have 8 months to enroll in Medicare Part B. If you don't, you have to wait till the next enrollment period, and there will be a penalty on the premium for every year you wait. So 7 months to initially apply, right? 8 months to enroll in Part B once you're no longer covered. Then once you enroll in Part B, 7 months to initially enroll, 8 months to enroll in B once you've enrolled you've terminated your coverage. And then once you've enrolled in B, you now have a 6-month window to enroll in a supplemental plan to protect your insurability. So 8 months to protect your premium, and then 6 months to protect your insurability. So you're 70 years old, your spouse retires, no longer covered by his or her plan. You now have an 8-month window to enroll in Medicare Part B. If you enroll day 1, how long do you have to wait to enroll in your supplemental plan? 6 months, right? If you wait 7 months and 29 days, you enroll in Part B, how long do you have to enroll in your supplemental plan? 6 months. The 6-month clock starts the day you enroll in Part B. Does that make sense? Okay, critical to know, because most people don't know. They wait, they think, I don't need this now. They did need it, they enroll, and the premium penalties stay with you throughout your retirement. So the premiums I showed you will be even higher. We want to help you avoid that mistake. Okay, so let me fast forward through. And we'll take you to now the resources available to you. Medicare.gov is a wonderful website. I'm on it multiple times a week. It's very intuitive, great search engine on there. If you're confused about the different supplemental plans that are available, type in Medigap or supplemental plans. And it'll walk you through a question and answer theme to identify what plan makes the most sense for you. It won't tell you which insurance company to buy it from, but now you can shop the insurance companies because those plans are standardized. So Medicare.gov. Also, if you look up your states, like the New York Department of Aging, and you look up the SHIP office in New York, there are licensed individuals. They don't sell plans. They're not financial advisors, but they can answer your questions personally about the types of questions you have that you can also find on the website. So website and personal. So two resources for you. Finally, the plan. This boils down to coming up with a way to provide you with the details as to the cost for your health care so your financial advisor can come up with the numbers for your health care. We personalize it, and ultimately, in the end, based on your profile, your longevity, the investment you need, and of course, we can show you if you don't do it, what it's going to cost you. We provide you with a cost assessment. And in your kit, what you'll find on the right-hand side are a couple fact finders in the back. If you'll pull that out, if you'll flip it over, what you will see is we have metro regions on the very back of that cost assessment fact finder, and it lists each of the states and each of the metro regions within those states where long-term care costs can vary. So look at New York, and as you might imagine, someone upstate would incur different long-term care costs from someone downstate. Someone in Manhattan would incur different long-term care costs from someone on Long Island. We can drill down to the granular level for you on both health care and long-term care. Now, if you flip it back over, what you'll see on here, and we're going to ask you if you're willing to do so, if you see the value in the presentation and would like to know with no cost or obligation what your health care costs may be, we'll ask you to fill one of these out. It only takes about 5 minutes. But as we look at the very top, you can check one of three boxes. Do you want to show just Medicare? Do you want to show just long-term care costs? Or do you want to show both? And if you want to show both, then just pay attention to which metro region might make the most sense for you. Note, it's not necessarily where you live. Maybe you have adult children. You've had this conversation with them already, and they live in Virginia. And you do want to have your long-term care in Virginia because they're there and it may cost less. You can use the metro regions that more appropriately identify where you will have that cost delivered, okay, or care delivered. So the very top part in the gray, that's where your financial advisor will complete their information. But just below that, if you want to take 5 minutes and walk through this with me now, and if you fill this out, they will collect it. It'll be sent back to Nationwide. Nationwide will complete this and send it back within 3 to 5 business days. Our privacy policy is spelled out in the output, and it simply says this will not be used for any other reason, no insurance reasons, will not be shared with anyone else except your financial advisor to give them your potential health care costs so they can help determine how to invest your money to help you meet those health care costs. So the very first thing we would need for you to fill out will be who you are. And so name, first name, last name, gender is on there, state of residence. Why? Because Milliman will help us break down those health care costs by state. How old are you now? What age would you like to retire? We all like to retire, what, 55, 60, right? But reality says we're going to retire at a certain age. What age is that? And that will help determine your health care costs as well. Why? Because if you put down 60, then we're going to show 5 years of private insurance costs. Until age 65, we'll show your Medicare costs. And as you know, private insurance costs are a lot more expensive, and that can have an impact on when you retire. Okay? So we've got that. So who you are, Milliman drills down based on where you live, your gender, and your age. Secondly, as you can see here, the yes or no questions. And ultimately, again, it's just have you ever had, and the only two answers that Milliman needs any detail on will be when it comes to a cancer diagnosis and what was the second one? Is it multiple sclerosis? MS, right. So I think it was those two, right? So if you've ever had those or been diagnosed with those, again, why? Because the recency of the past can have an impact on the cost of the future. As you work down through those, people ask, well, what if I smoke and no longer smoke? Well, this is not about trying to purchase insurance. We're not looking at how healthy you want to be rated. It's simply what has your health history been as a predictor to what your health future can be. So if you stopped 10 years ago, you can check no. But if you stopped 10 days ago, I'd say, well, you may want to rethink that. okay? But just, be honest with your future costs. That's all that is. And then finally, once you work your way down, you can see how simple this is. It's what do you anticipate your modified adjusted gross income to be in the future? Because now you know that will have an impact of how much your Social Security check on a monthly basis will be reduced when it comes to your Part B premiums. And I realize this is very personal. I realize it's confidential. As if you feel like this may not be the best place to do this and you still want to do it, please consider doing it and making sure you have a chance to turn it back in, and we'll be more than glad to get that report turned around for you as well. But even when you're done, if you just want to turn that over as we wrap up here for your questions, we'll help you maintain your confidentiality as well. So as some of you are finishing there, I know I've squeezed this into a smaller can of tuna fish here in the end for time, but let me see what questions you might have for me, and I'll repeat them for the benefit of the recording here. So.